Hey everyone, welcome back. Here are the most commonly tested medications. Let's master the drugs that start with the letter I. Ibuprofen is used to treat pain, fever, and inflammation. Ibandronate is used to treat and prevent osteoporosis. Ifosfamide is used in chemotherapy to treat various cancers, including testicular cancer, sarcomas, and lymphomas. Imatinib is used to treat certain types of leukemia, for example, chronic myeloid leukemia and other cancers. Imipenem is used to treat severe bacterial infections. Imipramine is used to treat depression, panic disorder, and childhood enuresis, bedwetting. Immune globulin is used to treat primary immunodeficiency disorders, certain autoimmune conditions, and severe infections. Indomethacin is used to treat pain, inflammation, and to close a patent ductus arteriosus in premature infants. Infliximab is used to treat autoimmune diseases, for example, rheumatoid arthritis, Crohn's disease, and psoriasis. Insulin aspart is a rapid-acting insulin used to lower blood sugar quickly in 5 to 15 minutes in people with type 1 or type 2 diabetes, often taken before meals. Insulin detamir is used to provide long-acting blood sugar control in people with type 1 or type 2 diabetes. Insulin glargine is used to provide long-acting blood sugar control in people with type 1 or type 2 diabetes. Insulin lispro is a rapid-acting insulin used to lower blood sugar quickly in 5 to 15 minutes in people with type 1 or type 2 diabetes, often taken before meals. Insulin NPH is used to provide intermediate-acting blood sugar control in people with type 1 or type 2 diabetes. Regular insulin is used to provide short-acting blood sugar control in people with type 1 or type 2 diabetes, often taken before meals or for correction. Iodine is used as an antiseptic for thyroid conditions and as a dietary supplement. Iopamidol is used as a contrast agent for various diagnostic imaging procedures. Apretropium is used to treat bronchospasm associated with chronic obstructive pulmonary disease, COPD, and asthma. Irbesartan is used to treat high blood pressure and diabetic nephropathy. Iron dextrin is used to treat iron deficiency anemia, especially when oral iron is ineffective or not tolerated. Isosorbide is used to prevent and treat angina, chest pain, and to manage heart failure. Isotretinoin is used to treat severe recalcitrant nodular acne. Let's keep going. Here are the adverse reactions of the drugs that start with the letter I that exams love to test. Ibuprofen. Adverse reactions. Gastrointestinal upset. For example, nausea, dyspepsia, abdominal pain. Diarrhea, constipation, headache, dizziness, edema. Increased risk of gastrointestinal bleeding or ulceration, increased risk of cardiovascular thrombotic events, for example, myocardial infarction, stroke. Ibandronate adverse reactions, dyspepsia, nausea, abdominal pain, diarrhea, musculoskeletal pain, flu-like symptoms, esophagitis, especially if not taken with sufficient water or remaining upright, osteonecrosis of the jaw, rare, but serious. Ifosfamide, adverse reactions, myelosuppression, leukopenia, thrombocytopenia, hemorrhagic cystitis, can be severe, prevented with mesna, nausea, vomiting, severe, alopecia, neurotoxicity, for example, confusion, seizures, coma, nephrotoxicity, fatigue. Imatinib adverse reactions, fluid retention, for example, edema, pleural effusion, nausea, vomiting, diarrhea, muscle cramps, musculoskeletal pain, fatigue, rash, myelosuppression, for example, neutropenia, thrombocytopenia, elevated liver enzymes. Imipenem, adverse reactions, nausea, vomiting, diarrhea, rash, seizures, especially in patients with CNS disorders or renal impairment, injection site reactions, elevated liver enzymes, C. difficile-associated diarrhea, insulin regular adverse reactions, hypoglycemia, low blood sugar, injection site reactions, for example, redness, swelling, itching, lipodystrophy, weight gain, allergic reactions, rare, including anaphylaxis. Iodine, adverse reactions, topical antiseptic, skin irritation, allergic reactions, for example, rash, hives. Oral systemic, taste disturbances, nausea, vomiting, diarrhea, stomach pain, hypersensitivity reactions. Thyroid dysfunction, for example, hyperthyroidism, hypothyroidism. Iopamidol adverse reactions, nausea, flushing, headache, dizziness, warmth sensation, pain at injection site. More serious reactions, for example, anaphylactoid reactions, renal dysfunction, thyroid dysfunction, are rare but possible. Ipratropium, adverse reactions, dry mouth, cough, pharyngitis, nausea, headache, dizziness, can cause paradoxical bronchospasm, blurred vision, or urinary retention, especially with prostatic hypertrophy. Irbesartan, adverse reactions, dizziness, fatigue, headache, orthostatic hypotension, hyperkalemia, acute kidney injury, angioedema, rare but serious. Iron dextrin, adverse reactions, infusion-related reactions, for example, fever, chills, dizziness, malaise, muscle pain, nausea, vomiting, hypotension. Hypersensitivity reactions can be severe, including anaphylaxis, injection site discoloration, abdominal pain, headache. Isosorbide, dinitrate adverse reactions, headache, often severe, nitrate headache, dizziness, lightheadedness, flushing, orthostatic hypotension, tachycardia, nausea, vomiting. Isotretinoin, adverse reactions, dry skin, dry lips, cheilitis, dry eyes, nosebleeds, joint pain, muscle aches, headache, mood changes, for example, depression, suicidal ideation. Elevated liver enzymes, elevated triglycerides, photosensitivity, can also cause severe birth defects. Let's finish strong by doing the contraindications or black box warnings of the most commonly tested drugs that start with the letter I. Ibuprofen. Contraindications. History of asthma, urticaria, or other allergic type reactions after taking aspirin or other NSAIDs, coronary artery bypass graft, CABG surgery, contraindicated for the treatment of perioperative pain, severe renal impairment, severe heart failure. Black box warning, cardiovascular thrombotic events. NSAIDs increase the risk of serious cardiovascular thrombotic events, myocardial infarction, and stroke, which can be fatal. This risk may increase with duration of use. Gastrointestinal risk. NSAIDs increase the risk of serious gastrointestinal adverse events, including bleeding, ulceration, and perforation of the stomach or intestines, which can be fatal. Bandronate contraindications. Abnormalities of the esophagus, which delay esophageal emptying, for example, stricture or achalasia, inability to stand or sit upright for at least 60 minutes, uncorrected hypocalcemia, hypersensitivity to ibandronate. Black box warning, none. Ifosfamide, contraindications, hypersensitivity to ifosfamide. Black box warning, none but carries warnings for myelosuppression, neurotoxicity, hemorrhagic cystitis, and nephrotoxicity. Imatinib contraindications, hypersensitivity to imatinib. Black box warning, none. Imipenem cilastatin, contraindications, hypersensitivity to imipenem cilastatin, any carbapenem antibacterial drug, or to other beta-lactam antibacterials, for example, penicillins or cephalosporins. Black box warning, serious infections, increased risk of serious infections leading to hospitalization or death, including tuberculosis, TB, invasive fungal infections, and other opportunistic infections. Patients should be evaluated for TB risk factors and tested for latent TB. Malignancy, increased risk of lymphomas and other malignancies, some fatal, reported in children and adolescents treated with TNF blockers. Insulin aspart, Contraindications: hypoglycemia, hypersensitivity to insulin aspart, or any of its excipients. Black box warning: none. Insulin dedamer. Contraindications: hypoglycemia, hypersensitivity to insulin dedamer, or any of its excipients. Black box warning: none. Insulin glargine. Contraindications: hypoglycemia, hypersensitivity to insulin glargine, or any of its excipients. Black box warning: none. Insulin lispro. Contraindications: hypoglycemia, hypersensitivity to insulin lispro, or any of its excipients. Black box warning: none. And insulin, NPH, contraindications: hypoglycemia, hypersensitivity to insulin, NPH, or any of its excipients. Black box warning: none. Insulin regular contraindications: hypoglycemia, hypersensitivity to insulin regular, or any of its excipients. Black box warning: none. Iodine, systemic oral use. Contraindications: hypersensitivity to iodine, hyperthyroidism, pulmonary tuberculosis for some historical uses. Black box warning: none. Iopamidol, contraindications: hypersensitivity to iopamidol or other iodinated contrast media. Black box warning: none. Ipratropium, contraindications: hypersensitivity to atropine or its derivatives, or to any component of the product. Black box warning: none. Irbesartan, contraindications: hypersensitivity to irbesartan, concomitant use with aliskiren in patients with diabetes. Black box warning: drugs that act directly on the renin-angiotensin system can cause injury and death to the developing fetus. Discontinue it as soon as pregnancy is detected. Iron dextran, contraindications: hypersensitivity to iron dextran, all anemias not associated with iron deficiency, hemochromatosis, hemosiderosis. Black box warning: anaphylactic type reactions. Risk of severe and potentially fatal anaphylactic type reactions, including cardiovascular collapse, which may occur at any time during therapy. Administer a test dose before the full dose. Isosorbide, contraindications: concomitant use with phosphodiesterase 5, PDE5 inhibitors, for example, sildenafil, tadalafil, due to profound hypotension, severe hypotension, hypersensitivity to nitrates. Black box warning: none. Isotretinoin, contraindications: pregnancy, absolute contraindication, hypersensitivity to isotretinoin or any component. Black box warning: teratogenicity is a human teratogen and can cause severe birth defects. Female patients must comply with the iPledge risk management program requirements. Psychiatric adverse events can cause depression, psychosis, and rarely suicidal ideation and suicide. Other serious adverse events include elevated triglycerides, hepatotoxicity, inflammatory bowel disease, pancreatitis, and severe skin reactions.